Hello everyone, it's me again, and I'm so sorry for those who ask for how to deal with an incident on my interview questions. I never visited my YouTube channel since last year because I thought I will be quitting aged care. And just this week, I think last week, someone told me that my videos are helpful, and some were just sending me a message that they saw my videos online and it was an insight, a good help for them to go for an interview. So I thought I'll go check it, and I saw that it has 14,000 views. I don't know where did it came from. I hope it helped the others as well. So today I'll be talking about how to deal with incidents or falls in aged care. Because I'm back in aged care, so I'm doing this video because I think I am in good spirit now. Not good spirit, but at least when I give an information, it's from my heart. Char. Anyway, falls in aged care is very common. This is because of course, they're elderly and there's polypharmacy. They have got a lot of medications that can affect them. They have medications as well that makes them drowsy, dizzy. Everything is there. And also they're frail. They have problems with their mobility. And number one is behavioral also. If they're resistive to care, if they just want to fall, things can happen in aged care. So aged care is one of the most, not one of the most, but it's, I think, the top one incident in aged care. So what to do if you have a fall? So if you are the in-charge nurse in aged care, or you are the team leader in an aged care facility, what you firstly need to do is, just in case the staff, I'll just do a scenario, something like that, because it's easier for me to explain. So when a staff told you that that Mike had a fall, so you just go straight to Mike's room, or where did he fall, and the first thing you need to do is assess them, if they are okay, if they are fine, if there is an injury or not. So that is included in your head-to-toe assessment. So the first thing you need to do is head-to-toe assessment, if there's an injury or not. If there is an injury, what kind of injury is that? Is it a head strike, or loss of consciousness, or massive bleeding? For those things that you think that needs to be sent to the hospital, check the advanced care directive if they are for hospital transfer or not. If they are not for hospital transfer, if they have a family, what you need to do is just ring the family, double check with them. Hey, Mike had a fall and he's unconscious. Are you still happy for us not to send him to the hospital? Or, hey, Mike had a fall and he has a big skin tear in his forehead, on his head, and you think that it needs suturing. Just let the family know that I think it's better for him to be sent to the hospital, because we don't do any suturing in aged care unless you have very good surgeon or a doctor, which in one of my facility, a doctor does that. He's not keen of sending residents to the hospital. He comes, even though it's midnight, he comes to the facility and suture it. It's a new facility where I work with, and it's very nice. That's for that. Just confirm with the family. So even though they are not for hospital transfer, ring the family, confirm it with them, because sometimes they change their mind. Also, if they are for hospital transfer, when you call the family, let them know maybe they changed their mind too, and they don't want the patient to be sent to the hospital. That's for with injury. And after you ring the ambulance, stay with the patient, make sure they're safe. If there's bleeding, apply pressure. All your skills will go there. So while waiting for that ambulance to arrive, and after that, send the patient to the hospital. Okay. The things that you need to give to the ambulance is patient's medication chart, patient's profile, patient's care plan. You need to photocopy or print, but those are and the advanced care directive. Those are the main important thing. Patient's profile, medication chart, advanced care directive, and what did I say? Just go back to what did I say? And also dietary care plan. And 7 days progress notes too, if you can. So just make sure also that you give a good handover to the paramedics and you take a set of obs if you can. When the patient is deteriorated or anything while waiting for the ambulance, just ring ambulance straight away. So when you ring an ambulance, make sure, it's my first time to ring an ambulance, like I don't know what to say, but this is what you say: ring 000. If they ask what it is, ambulance, and if they ask what is the acuity of care, just say high, especially if they need to be transferred straight away to the ambulance. So it is with sirens and lights, high acuity. And you need to be ready what is the address of the facility and the phone number. For medium acuity, these are the patients that can wait for at least 90 minutes. If they had cardiac arrest, stroke, those are high level. Medium acuity, what can I think of about medium acuity? I always say medium if a doctor reviewed a resident that needs to be sent to the hospital because they have infected wounds. Those are medium acuity. Or when they had a fall and they have pain and you are suspecting any fractures, that is a medium acuity as long as they're still okay. So that's that with injury. So with fall without injury, what you need to do is make sure they're safe, isn't it? Do the head-to-toe assessment, do your observation as per the policy. Usually the observation is every 15 minutes for the first hour and every 4 hours for the next 24 hours, something like that. It will depend on the facility, but make sure to take your initial obs, okay? After that, you transfer the resident from the floor, for example, to the bed or the chair using a lifting machine. Anyone on the floor needs to be transferred with a lifting machine. Unless they can get up by themselves, and you can offer the chair, but don't try to get them up, and they can use the chair as to help them get up, something like that. But make sure you use a lifting machine and don't carry them. So if they are safe, continue with your neuro obs. And what you need to do, the documentation includes incident reporting. So that's number 1. So for both unwitnessed and witnessed fall and with injuries, make sure to do your incident reporting. So incident reporting, you describe what happened, where, and when. And there's usually a template in there, but the most important thing is be very accurate. Describe what happened, when, where, and what have you done. So the things that you need to do is notify the family, inform them of what happened, make sure to tell them the truth. That's what we call in oh my god, what's that? Oh my gosh, I forgot. So it will be on the top of my mind. Just give me a sec. I'll let you know when I remember it. So notify the family, notify the GP. If the GP can be rang, you can call them straight away and let them know someone had a fall so they can review via phone. But if not, book a locum. Those are the local doctors that come after 6 p.m. because falls needs to be reviewed within the first 24 hours after the fall. So you cannot delay them. But if their GP is coming the next day and they don't have any injury, that's fine. Wait for the GP and they can review the next day. Write it in the physio's book because the physio need to review the resident as well. So family, doctor review, physio review, and you've done your incident reporting. So after the incident reporting, make sure to review the relevant documentation. This includes your FRAT or the false risk assessment tool. every time you had a fall, make sure to review your frat. This will determine what's the level of their risk for falling. So, and you can see there the strategies that can be done. So so just review frat. Secondly, you need to review their care plan. Mobility care plan should be done by the physio. What you need to review is the medication, skin risk assessment, behavior as well if they have behaviors, and skin risk, behavior, and pressure injury risk, and medication assessment care plan. But in other aged care, it will depend on what system you're using. If it's e-case, for the two facility where I work that we're using e-case, we need to review the comprehensive care plans, which I told you about, the medication, pressure risk, injury, and skin, and mobility, and dietary care plan as well. So those are the main thing. But in the other facility, two facilities where I work, you just have to review frat, and that's it. Also monitor them if they have pain. If they have pain, in one of my facility, all falls should be on pain charting for 3 days. But on the other facility, in their policy, it says review, do a pain charting if clinically indicated. So if you say that the patient didn't had any verbal or non-verbal cues of pain post-fall, then you don't have to do a pain charting. That's that. So after you've done your documentation, just hand over to everyone that your patient had a fall, and also do a forward test. Just to rule out any confusion, because yes, fall as well, it can be caused by infection, especially UTI, and our elderlies are very at risk of UTI because they are not drinking. They have poor oral intake, especially fluids, and that's why they're susceptible to it, and they're incontinent as well. So things that can cause fall. And open disclosure, that's the most important thing. Yes, when you notify the family, you should there is the term open disclosure, that you will let the family know what exactly happened. Don't try to cover up yourself, because if something happens, it's your license. It's better to be honest and let them know that this is our strategies, and if it's from your end that something happened, if it's the staff, if it's the staff fault that the resident had a fall, just apologize. But if not, I never apologize. If the resident has behavioral issues and they usually just had a fall or just sit on the ground, on the floor, what to say is, I don't apologize because it's the resident's fault. I'll just let them know that we are continually observing the resident, and these are the falls prevention strategies in place. So that's that. So fall will be unwitnessed or witness. Sorry about that. Witnessed fall is when someone saw that the resident had a fall. Unwitnessed is when you did not see the fall. No one has seen it. So with a witnessed fall, and just in case you are there, you're assisting the patient, and then they are nearly having a fall, don't carry them, or don't try to carry them, because you might hurt yourself. So what you can do is slide with them. But if you feel unsafe, what to do, just let the patient fall, because first is your safety. That's what you always have to think too. Okay, so just a quick wrap up about fall. So fall will be unwitnessed and witnessed. So witness when someone witnessed a fall, unwitnessed when no one witnessed the fall, and if it's head strike or without head strike. So with head strike, I forgot to tell earlier, if they are on aspirin or any anticoagulants, aspirin, warfarin, that's the usual and the common one in aged care. Previously, we send them straight away to the hospital. But since COVID hits, we don't usually do that. As long as they're stable, even though they are on anticoagulant, we just ring the doctor to review or wait for the locum to review. So that's the other thing. So just when you start, maybe just clarify it with the management. So how do you deal with patients with anticoagulant medications? Do you send them straight away to the hospital, or read the policy? And if the policies say yes, send them straight away to the hospital, then just clarify it again with the RNs or the team leaders. And that's that. So you need to do your head-to-toe assessment. You need to do your observations as per the policy as well. And you need to review your false risk assessment tool. You need to review your care plan and assessments, relevance. Those are the medication chart, pressure injury risk, skin injury, behavior care plan, dietary care plan, and medication care plan. And make sure that you ask a doctor to review the patient. Put it down on a referral for the physio to review. If it's weekend, don't stress as long as there's no injury. Usually the physio will review it over the weekdays, because physio doesn't work over the weekend. And most important thing, notify the family, keep them on the loop, and open disclosure as what I've said. I think that's that for fall. And don't forget to complete your incident reporting comprehensively. Make sure you describe how did the fall happen, when and where. If you found them face forward or you found them near the door, just be very, very comprehensive and very detailed with your incident reporting. I know some facilities are not, but this is how to cover yourself, because it's your license. You work for it. So if something happened, just say, hey, that's my documentation. I put it in my notes that I found the patient lying on the floor, facing forward with forehead bleeding, and I've sent the patient straight away to the hospital. I've done all my assessment, because if something happens, there can be a deterioration, and then there will be a coroner's report just in case if someone died because of a fall. Yes, so just be very careful. Do your notes. I am so detailed with my notes. Not so detailed, but no, I try to be detailed with my notes to cover myself and to keep my license going on. And yes, that's that for fall. Thank you so much for watching. I'll try to do more videos about the other incidents, and I will upload as well some videos for my 2 aged care interviews this year. So yes, I went to 2 aged care interviews. So aged care is the same shit everywhere. It's just the environment that will change. So I love this new workplace where I'm working now. They are so good. Politics is not that too much. Yeah, that's what I don't want. And try to find a non-for-profit aged care in a small facility, because it's easier to manage. And good luck to every one of you who is starting in aged care. Aged care is a lovely place. You just have to be patient, and yes, you need patience plus compassion, and you just need to work with the team. That's the most important thing. Work with the team and make sure everyone is safe. And yeah, because it's a big team and it's a big residence. Not big, whole lot of residents, but I'm back in aged care, so it means aged care is good. Anyway, thank you, and I'll try to upload more videos. If you like this video, if you learned something, please like and subscribe. Yeah, that's that. Bye.